Believe it or not, cardiovascular disease is still a leading cause of death in men and women. And a number of years ago, probably a little more than a decade, it came under evaluation by a variety of different physicians, usually radiation oncologists, as well as urologists, that there may be some increased risk of cardiovascular events such as myocardial infarctions, strokes in patients who are receiving a GnRH agonist such as Leuprolide that's being used for the treatment of metastatic prostate cancer. This was taken very seriously both at the United States and Europe, such that black box warnings were listed on the products to indicate that there may be a disadvantage in giving people these drugs because it could increase cardiovascular events. Now, that's not taking into account that the men who have metastatic prostate cancer, of course, might be older. They may have pre-existing cardiovascular problems, hypertension, diabetes, in addition to having had some form of a cardiovascular event per se, and that these are people at very, very high risk. So the idea has been, is there really any background to this? Is this a real event or not? And this was really based on largely observational and retrospective studies that were done by radiation oncologists and a variety of other physicians to indicate that there was a very high risk. Given that we now have new drugs, in particular a GnRH agonist such as Degarelix, some preliminary data suggested that the amount of cardiovascular side effects in men receiving a GnRH antagonist might be fewer than men who receive a GnRH agonist. And very simply put, is it better if you are taking a drug that does not allow a flare in your testosterone level to occur, and is it better to use this drug as opposed to another drug? This has nothing to do with marketing. It has everything to do with, can we improve on taking care of men who have known cardiovascular disease? Do we want to improve and make it safe for them, or is there something that we're doing that would exacerbate anything that was a pre-existing condition?